Hello everybody, it's Krzys here from BusyHive. I am a massage therapist, and in this channel we're making videos for massage therapists. We answer some questions, do the vlogs, tips and tricks, and in this video we're gonna answer one of the questions which we found it on Facebook. So we follow lots of amazing people in industry, and they're creating lots of great resources which you can find and learn from. And one of those ones is Healthy Street. So Healthy Street is run by Marcin Wojtaszek, which is a London-based massage therapist, and he created this page for his business, but as well for educating the massage therapists. He creating Anatomy Hub, which he posts lots of great tips and visualization graphics and explain what's happening with the body and lots of other techniques. And one of the questions he asked was, what is your favorite part of the body you can work on? And one of my answers, it was just necks and occipitals, because there's lots of great stuff you can do there and they're very beneficial. So I answered he asked what sort of techniques I used. And I said it's decompression, massage, stretches, tractions and holds. And I promised him I'm gonna make a video with those techniques so we can share them with massage therapists. So let's get to it. So hi guys, yeah, as we said, we're gonna work and show you a couple of techniques which is working with the neck and the occipital ridge here. But obviously neck is attached to the shoulder, so we're gonna do all a little bit work in here as well. And we're gonna look at a couple of techniques which they're really great to work with this area. It's a decompression, massage, stretches, traction and holds. So we're gonna start with the first one. So first one, yeah, we're gonna have to say thank you to our guest today, is Ian. Thank you for using your body. And the main first thing is to make your clients comfortable and check if there's any issue or red flags before we're gonna start work. So you can lie down on the table. So we're gonna start with clients supine, so facing up, and we have a pillow in here just to make him feel more comfortable. As well, what I discovered, a really great tip, is if I'm just gonna take the pillow out. Some of the tables in here have a face hole inside the tables, and they obviously for the face, but if you come a little bit closer, Ian, a little bit up, good. If you place the client a little bit above the hole, it's really nice space in here, so you can actually work around the neck. That's just a tip for you. But let's just start with the pillow in here. So we're just gonna make you feel nice and comfortable. Is that okay?
Yeah.
Great. So first thing is decompression. So decompression is basically a therapy to relieve the pain in the neck and lower back and all the spines. But basically, the theory is about the stretching the spine to assist the take pressure of the joint and things which they just contract there, which they basically compressed. What I do if I'm just cradling on the head, I'm asking the client to relax. What I do is just pull. Just gently pull here and just hold and wait. And you can start feeling in a while that not only the tissues around here are starting to soften, but then we just decompressing the joints. Basically, when the joints are all together in there, you're just making a little bit of space there, so all the joints can recover and everything can just start kind of breathe and relax there. So what we do, just cradle in the neck and just pull. Another thing is what you can do, you can just grab whole neck underneath and your hand underneath. So basically what I'm doing is this underneath the neck, just basically for the better grip, and just relax just here at the occipital ridge and just lean back and ask your clients to take a couple of deep breaths. And you can just hold here, up to even 1 or 2 minutes. The next thing, which is great, obviously, is the massage. And the massage is basically using and working with the soft tissue around the structures. And obviously, we have lots of structures here, and it's not only in the neck, they're coming through and going in the shoulders. And as well, working with the neck, that's a local thing. we need to make sure we address everything globally. So we're going to work a little bit with the shoulders and the neck and the scalp as well. First thing, we just need to use some oil. So we have a little bit of the glide around there. So we can start around the shoulders here, and nice effleurage strokes in here, up to neck in here. Just kind of to warm up the area around it and underneath, to prepare for any, you know, deeper work in here. And it just feels nice. So apart from effleurage, we can work in here really nicely, just stretching and pulling from the shoulder up to the neck. What we can do just with the little fist or knuckles in here, just a little bit working on the base of the neck over here, you know, trapezius and all the structures around here. So just circle motions with the fist of the knuckles in here, just around the base. And with those ones, you can go around the shoulders. And at the base of the neck, we can go and continue moving around the base of the skull. And another great technique is what we're gonna do. We're just gonna scoop the neck. So we're gonna find the middle of the neck and we're gonna just pull apart and scoop from there. Pull and scoop to outside. So we're finding the middle of the neck. We're just pulling and scooping from inside outside. So we're just separating those tissues in there. Another great way is to work side lying. I love working side lying because really nicely you can open up and work with the neck in here. So what we're gonna do, we're just gonna put some little bit oil here. And it's really nicely because gravity in here as well help us. And just stretches those neck in here. A couple of just simple strokes just to work from the shoulder to the base to the neck. And you kind of hold the shoulder pin in here and just massage in here. As well, it's really good to, here we have a really nicely access to the ridge in here. It's really good, you can really nicely detail work around the occipital ridge and access those sub-occipitals deep muscles here. Attachment of SEM in here and really nicely detailed work. And obviously, really working with the clients, really good access is when you're working with his face down, so prone, when you have a really nice access to the back of the neck in here. And for this one, it's really good one technique. It's just a simple petrissage. When we just scoop the neck, just lifting the skin and the muscles and tissues around here. Very simple, very effective, very good for clients. It just feels amazing. And as well, just rolling around at the base of the neck, you can just do like that. You can come back and work more with the neck. One really good stretch, which I really like and have really effective, it's a front neck stretch with the support. What you're trying to do, just explain to the client what we're going to do. We're just going to flex your head position in here and I'm going to hold you and support you on the back. What I want you to do, just kind of let it go and just drop and don't hold. I'm gonna hold you and support you here. But because the flexion is quite forward, I want you to just give me your feedback. How does this feel, okay? So what we're just gonna do, I just want you to relax. Just take a couple of deep breaths. What I'm usually doing, I'm starting with the little strokes, movement in here and just going forward and forward and forward. I want you to just relax. And what you do, you just cradling your hands underneath the client's head, just under occipital ridge. And just want you to just relax and just drop your, that's the one. Exactly. And you will feel the client's gonna try to hold and help you. Just ask them to relax and let it go. How does that feel?
Can feel that loosening.
Okay. And just stay in here, find a barrier in here, stay a little bit here. If everything's starting to loosen up, and pull back on the base of the neck. And if things are just getting looser, you can ask, would you mind to go a little bit further?
Yeah.
And then what you do, just walk your elbows up and go for the bigger flexion and hold the head. And just relax and drop and drop. And I loved it because you can hold here and really good 2-3 minutes here. Make a lot of big difference. And when we finish the stretch, what I usually do, I ask clients to take one big breath and relax. On the breath out, I want you to just relax, 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 and very, very, very slowly with the gentle movement of the head, just drop back. Another great technique is to grab the shoulder underneath and just relax here. Just let it go. Just relax the shoulder. And what it is just very simple, gentle. Just pull for the clients to feel the stretch. And you're stretching all the structures here. And the same way, the gravity in here is just help us to pull the neck down. And you have a really nicely good stretch in here. And move the shoulder and pull. Move the shoulder and pull. Another thing on the list, it's called traction, and it's basically something similar to decompression, but with the traction we're using we can use towel in here, which is going to help us to decompress and pull and traction the neck. And what we need to do is to fold the towel like that underneath client head, really nicely position and just up the occipital ridge. What you need to do, just make sure the ears are tucked together, and just grab them and hold them pretty tight. And what you need to do, just ask client to breathe in and breathe out. And lean backwards by pulling on a towel. Couple of things here, make sure they're feeling okay with that, ask them for feedback. They might not hear you because their ears, the towel is around their ears, so it would be good verbal communication here. And just ask them to breathe. Do you think we can go a little bit more?
Yeah.
Okay. So with that, we just can pull a little bit. And I'm just not pulling, I'm just leaning back on the towel. And very, very important thing, as smooth, as easy you pulled in, the very, very important thing is when you're coming back, do that on the breath out and come back very, very slowly. So Ian, breathe in and out, and very, very, very slowly we're coming back to the rest position. And that. It's a really great technique, and you can repeat that a couple of times. Usually, I do that, do some stretches, massage exactly at the end of the session, because it just feels great and open up the structures and the joints around there. So with all the structural work and tissues and moving and pulling and everything, it's really good to just calm the system down and everything with the nice and gentle holds. And even just around the shoulder. When we ask the client, just take we nearly finished the session, couple of breaths. So everything just starts settling, coming down. So around the shoulders. The same cradling underneath from all this pulling and moving underneath. That's just that I'm not pulling anything. I'm just holding here under occipital ridge and just holding, cradling the head in here, and just ask client to breathe. It's making all this work more holistic, that we are not only just working structures, but we working with the person in here. This is not just the tissues and body, and make sure everything is nice and calm. And the same you can do even in here, around the temporals. And we finish with a couple of breaths. So this is just a couple of techniques to show you how to work with the neck. Obviously there's lots of different techniques, advanced therapies, but with just a couple of those ones you can have a really good session and very beneficial for your clients. So guys, if you like this video, consider subscribing, because we in this channel we're creating lots of videos like that. And if you like this video, just share it, click a like, and there's like a little bell so you can get notified for upcoming videos like that. Guys, be awesome massage therapists, and see you at the next video. Bye bye.